Hi, this is Reggie from Restore Plus Physical Therapy. One of the most common conditions we see in the office is a total knee replacement. Actually, total knee replacements are one of the most successful surgeries in all of medicine. Around 600,000 total knee replacements are done in the United States every year. So that's a very big number. We see a lot of them in the office day in and day out. Now, for these patients that had a knee replacement, a number of them will actually have a second knee replacement in the near future. Or actually, I've had patients who had bilateral knee, both knees done at the same time. Those are the few brave souls that decided to do that. And I tell you, the rehab process of a total knee replacement, it's not for people weak of heart. All right, it's a process. So there's a lot of work involved there. All right. Now, for some of these patients that had one knee replacement, the other one is bad too because of arthritis or whatever, they will require a second knee replacement. Common question that I get asked is, when do they go for the second knee replacement? Now, I want to tell you this, my timeline when it comes to this, because the time frame that we tell patients recovery of a total knee replacement is around 6 months to a year. All right, so that's the time frame that we tell people to recover from a knee replacement. So when do they go for a second knee replacement if they really have to? If they're in a hurry and they really cannot wait or they don't want to wait much longer, my recommendation is wait for 3 months, because at that time the first surgery is healing, so that will enable them to go through the second replacement and be able to rely on the first knee at least without flaring it up too much. Ideally though, my recommendation is waiting 6 months. All right, so why do I pick 6 months? Because usually around the 6 months time, if everything progresses well as expected, that first knee replacement will be very good already. They'll be able to do, basically almost everything that they have to do. Walking, climbing steps, they'll be at work already by then. No assistive devices needed. It will be able to take all that load and abuse that that will be put on it if you undergo a second knee replacement. Right? Because you have to remember, when you undergo the second knee replacement, you're going to be putting a lot of work on that other knee. So if it's good and healthy, then it's not going to flare up and it's not going to give you that much problem. 3 months, it's still kind of risky because that knee is still healing. So if you heal really fast, then that should be okay. If not, you may encounter some issues in terms of inflammation and getting that knee a little worse. All right. So, but that's not to say that it cannot be done. So definitely you can do that if you really cannot wait too long anymore. But like I said, my recommendation is waiting 6 months so you get that leg flexible, get that first knee replacement good, flexible, strong, inflammation start coming down. So that way, when you go for a second knee replacement, it will be an easier experience for you. All right, and you kind of know what to expect already. So you do, the recovery tends to be better. All right, so feel free to share this with people that may need the second replacement or have this question in mind. Feel free to like us on Facebook or follow us on Instagram or subscribe to our YouTube channel. I would love to hear what you think about this topic or this video, so feel free to leave your comments below. And if you have any questions, if you're gonna undergo a knee replacement or someone will be undergoing one, or especially if it's going to be a second knee replacement, you have any questions, feel free to contact us in the number below. And if you've had the knee replacement, you're looking for experts who will be able to help you in the rehab, in the recovery process, don't hesitate to give us a call. We'll be able to set up a time that we'll be able to evaluate your condition, and depending on what the result of your surgery is, we'll be able to create a custom program that will help you recover from that knee replacement the quickest way possible. All right, so I'll see you in the next video. Take care, stay safe, and stay pain-free. Bye.